Before you begin, perform hand hygiene and open your prep kit away from the patient on a separate prep stand. Don sterile gloves. Place sterile towels around the area that you will be prepping to prevent pooling of the prep solution underneath the patient. Next, you will prepare your tray by putting the Betadine paint and the Betadine scrub on the sponges. In this tray, the orange label is the scrub and the green label is the paint. The paint goes on the sponges with the sticks and the scrub goes on the other sponges. Begin by using the cotton tip applicators with the surgical scrub. Clean the umbilicus. Begin with the incision site and work your way out, leaving the groin area for last. When you are prepping, always remember to perform hand hygiene, wear gloves and long sleeves, prep from the incision side and work your way out, or from clean to dirty and use all the sponges. Next, you'll use the 2 remaining sterile towels to dry the area that you just prepped. Gently press down and lift up and away so that you don't drag the edge of the sterile towel over the area you just prepped. Repeat the process for the second towel. Next, you'll use the Betadine paint, beginning with the incision and working your way out. Remember not to go over an area that you've already prepped, and the groin area is last. After you're done painting, the prep needs to dry for 5 minutes before you drape. Chlorhexidine scrub is the same process as the Betadine scrub. Begin with the umbilicus and work your way out, going from clean to dirty. The manufacturer recommends scrubbing for at least 2 minutes, drying the area, and scrubbing for an additional 2 minutes. To begin, open the DuraPrep package and press firmly on the bottom of the applicator to activate the solution. Once the sponge fills with solution, use the cotton-tipped applicators to apply DuraPrep to the umbilicus. Using the DuraPrep, paint the solution onto the abdomen, distributing the solution evenly over one layer. Be careful not to go over an area that you've already prepped. Work your way from the inside out. DuraPrep needs to dry for at least 3 minutes. Since it contains alcohol, it's highly flammable unless it's dried. To use ChloraPrep, open the package and remove the applicator. Press firmly on the handle to activate the solution to go into the sponge. Use the cotton-tipped applicators to apply the ChloraPrep to the umbilicus. Remember, ChloraPrep is a scrub, not a paint, so begin at the incision site and scrub back and forth as you move towards the outside. You may need to use 2 ChloraPrep applicators depending on the surface area that you are prepping. ChloraPrep also contains alcohol and needs to dry for at least 3 minutes to reduce the risk of fire.